Hello, my name is Angeline Rusu, and the title of my senior capstone project is called Quality Sonography Anatomy Training Program Curriculum. I am part of the Bachelor's in Radiology Sciences program with a focus in general ultrasound. The idea I have chosen for my capstone project is an educational training program that involves teaching general sonographers how to scan OB anatomy scanning. It is a 4 to 6 week curriculum that I have built called Quality Sonography Anatomy Training. This idea came from conversations that I've had with multiple coworkers expressing their desire and need for learning OB anatomy scanning, many of which have not had the opportunities to learn OB scanning during the 1 to 2 year general ultrasound program. And because of that, they have taken positions that do not require that as part of their job performance or expectations. This greatly limits one's job opportunities in the ultrasound field today because there are multiple outpatient clinics and hospitals that do require knowing how to scan OB anatomy scanning as well as being certified in this specialty. And a quote that I pulled up from the ARDMS website, which is the governing authority of American Registered Diagnostic Medical Sonography organization, is from Kayla Sickles, who has had multiple specialties, including OBGYN in ultrasound. She writes, "From a professional perspective, earning additional ARDMS credentials is a huge advantage. More credentials mean more employment opportunities. The target market for this program will be general sonographers who desire to learn OB anatomy. The objectives of quality anatomy sonography training are the following. Sonographers should be able to scan a full anatomy scan within 1 to 1.5 hours by the end of the 4-week course. Students should pass all competency tests, and students will be able to sit for their OBGYN boards to become board certified. The outcomes I hope to achieve with quality anatomy sonography training are that students enrolled in the program can become competent in OB and further their career development, open new job opportunities, and become more marketable in the field today. During my presentation, I will focus firstly on what the Quality Anatomy Sonography Training Program is, the materials that I've created for it, what the 2-day trial is and what that entails, and lastly, I will present a conclusion based on the information demonstrated throughout the presentation. To begin with, the curriculum development process involved creating first the outline of the topics per week and then the details of each week, including a PowerPoint presentation and weekly quizzes of the materials covered. I then created an overview of the 4-week curriculum, the requirements for partaking in the program, objectives for the program, reasons for why it would benefit sonographers, how the program's weekly schedule will be set up, weekly quizzes, and lastly, the final exam. I'd like to jump over to 2 slides down, which will show Appendix B. Appendix B is one of 3 appendices I have created for my curriculum. And the following is the outline of kind of the core pieces of my 4 to 6 week curriculum. Every single week, students will be taught different anatomical systems of the fetus, as well as what is normal and what is abnormal or pathology, and students will also learn how to scan these anatomical parts. If I click on this hyperlink, Appendix B, here is an example of the materials I had just discussed. And at the very end, I'd like to show you that final competency exam that students will be expected to pass. And there will be a written, which is displayed here for the final competency. And there will also be a scanning exam, which students will be expected to pass within an hour to an hour and a half and be checked off on all of the fetal anatomical parts listed here in this check-off box. Before actually teaching the 4 to 6 week curriculum training program, I decided to conduct a 2-day trial conducted at a pregnancy center, one in which I have taught at, called Women's Resource Pregnancy Center in Las Vegas, Nevada, as a way of testing out my 4 to 6 week training program and also creating an opportunity for myself to receive feedback from students and evaluate and implement results into my program. The 2-day trial entails a crash course of the basics of OB anatomy scanning with both in-classroom teaching as well as in-lab scanning on pregnant volunteer patients for 2 days, 8 hours a day. It will also provide information on the important reasons for anatomy scanning according to the AIUM standards, as well as basics of and the protocols for anatomy scanning according to the ARDMS standards, the benefits for learning OB anatomy scanning for sonographers, and details about the full 4 to 6 week training program. At the end of the trial, the students will be given a scanning test to evaluate their skill set in scanning anatomy and identify areas that they need to improve in. They will also be given a survey and an opportunity for feedback about the trial. The objectives and hopeful outcomes for the 2-day trial are the following. Shows general sonographers the extent of their current scanning abilities in OB anatomy examination by administering tests for assessment. Additional objectives are teaching the basics of ultrasound anatomy scanning and protocols, presenting information about the quality sonography anatomy training program to help students decide if the 4 to 6 week course is something they want to do, and creating an opportunity for feedback, which may be implemented into the program. I'd like to jump down to just one slide over, which shows now Appendix A, again, one of 3 appendices. Appendix A covers that 2-day trial that I just went over, and if I click on this hyperlink, Appendix A, this is an example of the materials that we had just gone over. Next, I'd like to show you Appendix C, which is the last appendix of my 4 to 6 week curriculum. And it's a PowerPoint that covers the main material throughout this program. It covers normal and abnormal fetal anatomy and pathology. And if we click on this hyperlink, just show you an example of it. So this is my PowerPoint that I've created using different resources, which I'll go over on the next slide. The most helpful resources I used throughout my Capstone Project and in order to create my curriculum were the AIUM OB Anatomy Exam Indications, the Obstetric and Gynecological Textbook by C. Peterson, the American Registered Diagnostic Medical Sonographer Obstetrics and Gynecological OBGYN Outline, and Hope Imaging's Basic Ultrasound Concepts curriculum. Before taking the course, students will purchase Peterson's 2017 Obstetrics and Gynecological Text. The sources for the images that I'm using throughout my presentation and curriculum PowerPoint may come from all 4 resources. Connie Ambreth, who is my mentor and a friend throughout my Capstone Project, has been a very effective and useful resource. She's an RDMS with over 30 years of experience, and she currently owns a limited OB ultrasound training program called Sparrow Solutions, one in which I actually currently work for as well. She has also founded Hope Imaging, which is a nonprofit organization that teaches ultrasound in developing countries, one in which I work with as well. Her expertise and knowledge of the field has been used greatly in her advice and guidance throughout my project. Moving on to the need for this type of training program, general sonographers can face a lack of an OB anatomy scanning and training within their 1 to 2 year ultrasound programs. Understanding and scanning OB is important to general sonographers since it's not uncommon to encounter patients who need an OB scan, and the ability to meet one's patient's needs is vital. During an OB exam, patients and patients' physicians have questions about the fetus, such as, is the fetus growing correctly? Does it have all of its anatomical parts? Have they developed correctly as well? Being able to provide an in-depth exam will provide the patient a more accurate diagnosis and ultimately perinatology care and delivery plan. My 4 to 6 week training curriculum and program is needed because currently general sonography programs offer very little to no OB ultrasound scanning because of the lack of clinics willing to teach interns obstetrical scanning. For example, in my current city, San Diego, only 3 hospitals train students in local ultrasound programs. Sharp Memorial Hospital, Sharp Grossmont Outpatient Pavilion, and UCSD, and one in which does not even offer OB anatomy training. San Diego has 6 main hospital systems with multiple branches and clinics that provide OB anatomy scanning. Sharp Healthcare is an example of one of the 6, and Sharp Healthcare has 7 clinical sites that provide OB anatomy scanning, but only one of those takes on local ultrasound students. This is due to the sensitivity of this patient population and type of exam, as well as the difficulty level and need for highly technical skill during the examination. Another reason I found is the emphasis on productivity in today's competitive healthcare market. Keeping the numbers of patients scanned high is important for businesses to be successful and competitive. By taking on interns to learn ultrasound, specifically OB anatomy scanning, which already is one of the longest exams in general ultrasound labs, your productivity and access scores decrease because students will not be able to scan as quickly as sonographers. So far, I have not come across another OB training program exactly like the one I am proposing. Sparrow Solutions teaches OB sonography to physicians and nurses in pregnancy centers, but not full anatomy scanning as needed for registered sonographers who wish to perform this type of exam in their clinical setting as well as become OBGYN certified. The AIUM, the American Institute of Ultrasound and Medicine, offers short seminars on OB scanning, but not hands-on experience. Quality sonography anatomy training will be unique in that the program will not only offer classroom teaching of fetal anatomy and pathology, but also hands-on training for programs students on volunteer pregnant patients. The program will focus mostly on hands-on training because that's the most important way and effective way a student will learn how to scan OB anatomy. This specialized training program is important because it will meet the needs for sonographers in the field today who want to learn OB ultrasound but have not had the opportunity to do so in their current workplace. In regard to the outcome of the 2-day trial, originally when I had called the setting for a 2-day trial, the Women's Resource Pregnancy Center in Las Vegas, Nevada, I had 2 separate set of dates available in which I could conduct the trial. Next, I proceeded to talk with the 2 colleagues who had displayed an interest in the 2-day trial. When trying to confirm the weekends that Connie and I could conduct this with them, they both stated they were no longer able to be a part of the trial due to a variety of both financial and personal reasons. Upon hearing this news, I spoke with Jennifer and was encouraged to still continue to create the 2-day trial curriculum. I didn't receive the feedback I was hoping for from my colleagues, but I will continue to try to conduct this trial at another time because I believe it is vital to exploring the effectiveness of the 4 to 6 week training program. Upon writing the 2-day trial, I learned that it is important to include the objectives of it, the clinical setting in which it would be conducted, and the schedule and agendas for both day 1 and day 2. That way, a clear direction and goal is set for the trial participants. When creating the 4 to 6 week curriculum, basing my curriculum off the standard anatomy protocol per the ARDMS was vital because it provided the foundation for the type of material needed to be covered in class, as well as showed me what sort of objectives and expectations will be needed in order to prepare the students, sonographers, for successfully scanning OB anatomy exams. In brief, the Quality Sonography Anatomy Training Program's expected projected outcomes will prove successful based on the ARDMS guidelines and standards. The ARDMS requires a registered diagnostics medical sonographer to have a clinical verification form filled and signed off by a sonographer who is registered in the area of specialty they are striving for in order to take their OB boards. The Quality Sonography Anatomy Training Program can provide the CV form for our students as well as teach all of the expectations required on the form. An example of the OBGYN CV form is shown on the slide here. The Quality Sonography Anatomy Training Program will also teach students about maternal and fetal organ systems and how to scan them according to the ARDMS. And according to the ARDMS Obstetrics and Gynecological OBGYN outline. And here's actually an example of that here too. In conclusion, the 4 to 6 week curriculum Quality Sonography Anatomy Training Program is an important educational program because it meets the current needs for general sonographers to learn how to perform OB anatomy examinations. It meets the expectations of the ARDMS for general sonographers to take the OBGYN boards, will develop students' skill set and competency in obstetrical scanning, further career development, enrich job opportunities, and ultimately help sonographers become more marketable. In the future, I would like to conduct that 2-day trial, analyze results and feedback, and further implement those results into improving my program, Quality Sonography Anatomy Training. I would then like to launch that 4 to 6 week program and advertise it to local general sonographers in my city. On my next slides, I have my references here, and I just want to say thank you so much for your attention.